Hey there, Dr Todd Cameron here, GP and co-founder at M3 Health. Today I want to chat to you about how to get the best out of consultations when you have either a Commonwealth Seniors card or a healthcare care card. We know that over the past 2 decades, the federal government has progressively ignored your funding in regard to the MBS, Medicare funding for general practice services. You can see by this graph that there's been a really wide separation, a lot more money going into hospitals and a lot less money going to general practice. And that has an impact on the quality of care that you can access because it hasn't kept pace with the cost of providing quality care. And so this video is about people who have healthcare cards or Commonwealth Senior Health cards. And these 2 cards are now subject to private billing in our practices. And that will be occurring very shortly. In order to get the details on that billing, please go to the fees tab of our website and you'll be able to see we have been able to hold the fees at a level below the normal full fee paying patients in the clinic, and we have been able to continue bulk billing, but only for pensioners and children aged 5 and under, so preschool children. Otherwise, everybody else is paying a private fee. As I said, we have been able to keep the fees reduced somewhat for those with the healthcare cards and the Commonwealth Seniors Health Card. Now, there are 2 types of consultations, broadly speaking, that it's really important you understand well and you get the best out of. The standard consultation is 15 minutes. In a 15-minute appointment, you can expect to get about 10 to 12 minutes with the GP because there is a little bit of time opening your file, understanding what your needs might be, whether there's been letters, pathology updates, etc., prior to you coming into the room. And then there's a little bit at the time making sure that you've got everything you need, medical certificates, prescriptions, referrals, updates, etc., at the end, and summarising as well as organising the next appointment. So standard consultations will usually be able to address one issue, but not very complex issues in that allocated time. If it is more complex or there are multiple smaller issues, then that requires a long consultation. That's a 30-minute consult. And you can generally expect to have between 22 and 25 minutes face-to-face with the GP during a long consultation. Mental health consultations are also long consultations that would not fit into a standard consultation. So it's really important that you prepare well, that you are well organised, and that you understand exactly what it is that you would like to cover in your consultation. And where possible, have a chat to your GP about that so as that you can have a joint discussion about what the priorities are for you in that consultation. We will continue to bulk bill any consultations that are associated with care planning, so a team care arrangement or a GP management plan or health assessments. So it's really important that we make the most of these consults so that you get the best value for your care, and that we do make sure that we include all of the people in your team in these plans. And that's usually up to 3 consults per year that are part of that. So that's important. That may reduce the number of visits you need to have that are ones that you'll personally fund. So let's make sure that we use all of the appropriate MBS item numbers, provided you qualify for them, but we use these appropriately as well to intelligently organise your care. Planning is going to be really important. You do need a budget now for your general practice care. That's really important to make sure that you continue to have access to a good clinic, and it's really important to have continuity with ideally 1 GP and 1, maybe 2 backup doctors in case that doctor isn't around. We know that makes a big difference. It's easier if you book everything online through HotDoc. You will, of course, be required to enter your payment details at the time of making an appointment. Otherwise, you can't make an appointment. So please make sure you pre-enter and pre-consent to payment for your consultation before it occurs. We're really grateful for your support during this time. It's really difficult making these decisions, but it has been an extensive consultation process with the team internally, and also we've done our best with the federal government to lobby on your behalf for greater MBS rebates. To date, that hasn't been successful, so it's really important that if that's important to you, that you have a discussion with your local Member of Parliament, and that would usually be a federal Member of Parliament. Make your position known on this, and particularly let people know that you will vote accordingly. That's the best advice really to get the government to take general practice funding seriously for you. Otherwise, these costs unfortunately will continue to rise. Thanks. I've been Todd Cameron. Appreciate your attention.